Okay, welcome. We know it's been a while since we've done a podcast, especially in the same room
I know,
together.
right?
This is
Exactly. This
this is
is
amazing.
this is a
Yeah,
treat.
it really is. Yeah, and we're not, having to worry about germs and pandemics. So,
That's
um,
long gone, I think.
yeah, long gone. So welcome. And Dr. Moore wanted to talk about what she had called O
Over the counter OTC.
OTC was the one I was like, what is that? And so she's going to explain it to us. You're going to learn right along with me.
Absolutely. So there's been a lot in the news lately over the last several months, especially in October of last year when the Over the Counter Hearing Aid Act took place, and it allowed a special class of hearing aids to be called over the counter or self-fitting hearing aids or hearing devices. And so that's really been a large topic for a lot of people, and a lot of people out there think, great, I can save a lot of money, I can get the same thing that I might go see an audiologist or a hearing instrument specialist, and be able to treat my hearing loss the same way. And so what I just wanted to say in this video was just to kind of take some of that information and make sure that everyone has the facts of what OTC is versus a prescription hearing aid.
So OTC meaning that they can go to any, is it like a specific, almost specialized store? Is it just and literally Walmart? They can walk right in and
Yeah.
grab something off the
They,
counter.
they can literally walk in. It's usually going to might be over by the pharmacy in some stores. So, or if you go to like a Best Buy type store, it might be in some of their more consumer electronics area. But what it's designed to be is, yes, it is designed that a person that may perceive that they have some hearing loss can go in and pick this up off the shelf and be able to fit it to themselves. They might be able to download a special app by that particular company. There may be some companies that have name recognition that are making some of these devices, from Sennheiser, Sony, Bose. So those are some of the big companies that we're seeing that are bringing this to the market. Some of the other hearing aid manufacturers might also have an option that is going to be available to the consumer direct as well.
Real quick, so I want to roll something back.
Yep.
You touched something that said perceived hearing loss.
Right.
So I'm just assuming this is somebody that goes, hey, I may be having a hard time hearing. So
Yep.
this isn't something that they've even tested, then, correct?
Correct. The idea is that someone that is going to go purchase an over-the-counter device would not necessarily have to go to an audiologist or a hearing instrument specialist and have a hearing test.
Interesting.
They can literally say, I know I'm missing what's being said. I know that I'm not hearing like I used to, and I want to go and get a device and help me to hear better. And so they can literally go do that without having to go have a hearing test done to find out exactly what they may be hearing, what they may not be hearing. They can just say, I don't think I'm hearing well, and I'm going to go get this over-the-counter device, fit it to myself, and I should be able to hear a lot better.
What's the difference between what you're doing and what I'm perceiving I'm losing hearing loss? I'm
Right.
gonna go get a device. To me, it almost reminds me of like I can't hear very well. Maybe I need earbuds.
Right.
Right. And so, what's the biggest difference?
The biggest difference is that when you come to see an audiologist, you're going to have a comprehensive hearing evaluation, just like going to the eye doctor and having an eye test. And then they essentially put that screen on you and ask you,
Puff you with the air.
puff you with the air, right, and ask you, how well can you see these different. They make those manipulations. The same with the hearing test. So we're going to put you in a sound booth. We're going to put some earphones in your ears, and we're going to present some tones at different pitches and see how well you can hear, how softly you can hear those different pitches. And based on that, we can compare how you're hearing against a norm of data that we have for what's considered normal hearing. And if you fall within that range, we say your hearing's within normal. If you fall outside of that range, then we say, based on this, you no longer have hearing within the normal range. You may have, if it's this amount of hearing, you have a mild loss. You might have moderate. You might have severe. That means that you're going to have more difficulty hearing certain sounds like soft voices, higher pitch sounds, birds, children's voices, hearing in background noise, a number of things that most people experience when they start to lose their hearing.
So, looking at the data that you guys are gonna get from this test, are the over the counter? I mean, if there is no data,
Right.
how does this device that has no data, how does that react, or how does it benefit the person that's getting, or not benefit the person?
And that's sometimes we don't know. So we do have some data out there that shows some people that would go in and try these self-fitting devices because they've been around actually for a very long time.
Okay.
They just were named something different. They couldn't call them an actual hearing aid until recently, till
Okay.
legislation was passed. But they might have been like a hearing amplifier or a hearing
Mm.
enhancer or a personal sound amplifier or something like that. So what they've done is they've done some studies where they've had some people go and try some of these devices without having a hearing test, and then they've tried with some people that have had a hearing test and had either gone and gotten those or had some prescription based. And what they found is that some people were in the more mild hearing loss category, were able to make some adjustments that were pretty close to what we might have done with a prescription based hearing aid,
Okay.
but not always. So
Mm-hmm.
there's still going to be a lack of fine tuning, you might say, from a prescription hearing aid versus something that you're going to get self fitting over the counter.
Oh, interesting. So I would almost imagine that the over the counter is kind of like turning up the volume, right? And so they can hear a little better.
Right.
What are the types of customization and adjustments does the prescription hearing aid have?
So, a prescription hearing aid has research and data to base algorithms on how well you hear certain sounds or how well you don't hear certain sounds, and applies a certain amount of volume to those frequencies or those pitches, making sure that soft sounds are audible, medium sounds or normal conversational speech is comfortable, and loud sounds are not going to be too loud.
Okay.
So that's one of the ways that it is different than something that is self-fitting, that you may be very limited on how much you can manipulate low pitch sounds, bass, or high pitch sounds, treble. You may have some flexibility, but not to the same extent that you would from a prescription hearing aid.
Interesting. So let's talk, kind of dig a little deeper with these tones and like who or what would you hear normally with these types of tones that you may miss out if you're having an over the counter?
So a lot of times people will say, I can hear, but I don't understand.
Oh,
So they're
interesting. Okay.
missing the clarity or the fidelity of typical conversational speech. So most likely, as we age or have other means that affect our hearing, we always lose our higher pitch perception first. So that's really important for our consonants. 90% of our speech understanding comes from how well we hear consonants, which tend to be higher pitch sounds.
Okay.
So if we're missing that, we're missing a lot of the key words for understanding. We
Mm-hmm.
might think that someone said fan when they said ban. So it's
Yes.
those fine subtleties that make all the difference in how we perceive a sentence or context. If we miss some of those key sounds, then we're not getting the full picture of that. And the longer that we go without that, the harder our brain has to work to fill in that information.
So so we now know how things can be adjusted, right? Over
Correct.
for the prescription over next to the over the counter. What about build quality?
Build quality. That's a great question. So I think as far as the quality of the product, as far as the reliability of the product, I can't say that we have enough data for that yet with what now is on the market under this class of hearing aids called over-the-counter hearing aids.
Mm-hmm.
We have a lot of information on the personal sound amplifiers or the things that were done before. Some of those don't last as long, maybe a year or two.
Okay.
But with the over-the-counter hearing aids, especially if they're made by some of the big companies that we know are well known for making good quality electronic
Mm-hmm.
devices,
Mm-hmm.
we may see some good quality and some sound or longevity with that. The problem is, how long are they going to last for your perceived hearing? At some point, you're probably going to outgrow that because your hearing is most likely going to get worse, or there's going to be such a limitation of what that device can do. It's not going to continue to meet your growing needs.
Now I know we kind of discussed in the past about almost like hearing therapy. And obviously, and again, it's almost here they're just adjusting the sound. Um, is there a benefit to reducing the time that your hearing is degrading with a prescription hearing aid?
Absolutely. Yeah. The sooner that you treat any hearing loss that is identified, the better you're going to do long term with keeping your brain active and healthy. It's just like a rehabilitation. So if you think about when you have a knee replacement, and you have to go through physical therapy to re-strengthen or reteach yourself how to walk and use that knee again. If you just put that knee replacement in and then you don't walk for a while, it's not going to get back to
Yes.
pre-surgical or pre-ability. Same with hearing. So when you lose your hearing over time, your brain starts having trouble recognizing those sounds and loses its ability to fully understand what those sounds are. So a lot of guesses are happening. And so it takes longer to process what someone is saying. And again, the faster someone speaks, the harder it is to catch everything that's being said. You may find yourself waiting a minute and going, "Oh, that's what you said."
Yes.
It's because it's taking longer for all of that information to process.
It's like when the joke has been delivered and it's there's that 3 minute delay.
You got it.
You got the punchline.
You got the punchline. Exactly right. So when we can treat a hearing loss that's more mild, for example, we're able to give that smaller amount of volume earlier in a person's life, which is allowing the brain to have better access to that sound sooner. And then as you progressively get older, you get into your 50s, 60s, 70s, 80s, 90s, and you are more likely still losing a little bit of hearing, but your brain has had more time to hear through that correction and is able to keep up better as you age.
Fascinating. So my wife calls me frugal, and normally, or
And a lot of people are.
It is.
Yeah, there's nothing wrong with that.
Especially in today's economy, right?
Right.
Everybody's looking at at economics and our dollar value, right?
Yeah.
And inflation, but they may be looking at the over the counter and say, "Well, it's a heck of a lot cheaper."
Yeah.
But the way I kind of look at it is they don't know the experience between the two.
Exactly.
So are people able to experience a over the counter and or a one that's a prescription hearing aid?
Absolutely. So I'll kind of circle back to one of the comments you made just a moment ago with regards to the financial investment. So a lot of some people think that over the counter devices are going to be like $50 or $100.
Yeah,
They're
cheap.
made cheap or really inexpensive,
Yes.
and deliver the same quality that a prescription hearing aid that costs thousands of dollars
Yes.
would. And that's probably not going to happen.
Yeah.
But, and also at the same time, a lot of these over-the-counter or self-fitting hearing aids are probably not going to be that less expensive. They're going to be probably several hundreds of dollars to even maybe $1,000 or more.
Oh, wow. Interesting.
Yeah.
Okay.
Whereas prescription hearing aids, we can also fit a set of prescription hearing aids a lot of times in for $1,000 or a couple of $1,000s too.
Okay.
So a lot of us have that option where you can get a less expensive prescription hearing aid that still meets your needs, has better fidelity because we're able to program it specifically, verify it, all of that good stuff. So you're still saving some money, but you're getting that more precise programming available. Okay. But we also have ways that when we see people in our clinic and we identify them with hearing loss and we talk to them about hearing treatment using hearing aids as an option for that as part of that rehabilitative process, we may offer them an option of doing an at-home hearing aid demo. And so what that is we'll do a fitting of some demo devices, which essentially are the same as what we would sell prescription hearing aids. It's just they are demos that we can program over and over again. We can let that person take them home in their home environment for a week or two, try them out, see how they're doing in their day-to-day real-world situation. Nice. And then that allows them to come back. And most of the time people will say, yes, it made a difference. Now let's talk about what I can do to make this a permanent solution.
That is fantastic.
Yeah.
And so really we look at that of the customization, the personalization. Let's kind of talk about, and I think you mentioned this maybe before as we were talking, looking at the different hardware is there an advantage in the software?
Yeah, so a prescription-based hearing aid, we can program those settings within software that's made by that manufacturer.
Okay.
So we can hook it up to our computer, and an audiologist or hearing instrument specialist, we can get in there and make those adjustments. So if you want more bass, more treble, we want to add more speech enhancement, we want to make them sound better on your smartphone or streaming your television device, we can get in and manipulate that and make all those adjustments so that it sounds right. We can also verify it against standards for that particular hearing loss to make sure we're giving you the appropriate amount of sound for your individual ear. With an over-the-counter or self-fitting device, there is absolutely no option for us as a provider to hook it up to any software and make any adjustments. So any adjustments that can be made are going to be strictly by the consumer, either through an app, maybe a limited app on their smartphone or smart device, that they can make some very, I would say, less precise adjustments.
Okay.
Yep. And then that's all they can do. There's no other option for that.
So really, we're looking at the differences, and you can see the benefit. So one last question. I'm still looking
Yep.
at the two. I have
Yep.
both of them in hand. I tried the demo. Maybe I don't know, bought one and decided I can return it after I try it out
Right.
at Walmart. We know that the software can be more customized here, but let's say that my hearing continues to degrade. I'm still stuck with this. Are you able to continue to make further adjustments for the longevity of this this hearing aid
Yes.
that we got on prescription?
That's the beautiful part of it. Okay. Is yes, as long as we are able to program that device with the software, which a lot of times we're able to keep prescription hearing aids working 5, 7, sometimes longer years. So we can go in there when we retest hearing, which we recommend for most people is, either annually, depending on your case history, but every 2 years at least to do a new updated test. We can then reprogram, we put that new information into our computer system, we can reallocate or recalibrate those hearing aids to account for that change in your hearing, and it reassesses the appropriate amount of sound for that. And then we can go through and make any fine-tuning adjustments that need to be made.
Oh, that is fantastic. Okay, so I've made that decision.
Yep.
And I've done my research, and I've now watched this YouTube video.
Right.
Christy, how can they find you?
They can find us. We are located in Tucson, Arizona. So Sonora Hearing Care is the name of our business, and our website is sonorahearingcaretucson.com. We also can be reached by phone, 520-881-8740.
Fantastic. Well, thank you for viewing, and please like, follow, subscribe, leave a comment below. And until next time, thank you.
Thanks.